The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome. Glad you're back. Happy to see you. We are here for the next episode of TMD Demystified, and I am Tony Urbanek. For those of you who are brand new to my podcast, TMD Demystified, it is here to help you, whether you be a public, patient, or doctor, dentist or physician, to understand this disease and to help you navigate I want to say complexity, but it's not a complex disease. That's the problem. It is a simple disease. It's simple to understand, but is made to be complex by our system. It's not a complex disease. But to navigate the complexity of what is out there, trying to figure out what TMD is. Therefore, I named this podcast TMD Demystified. Today's topic and title is "A Patient with TMD Run in Circles is a Sobering Experience." A patient with TMD run in circles is a sobering experience. That is a true statement because of my 50-year effort to treat and solve this problem of TMD. I have been exposed to thousands of patients with this problem. For the first 36 years of my career, I operated the temporomandibular joint, operated on the temporomandibular joint over 2,000 times, 2,000 cases, half of them through an incision into the joint itself and doing various things to try to help surgically the joint, correct surgically the joint, and half of those cases were through an arthroscope, watching a television screen while I operated within the joint. After 36 years, I decided that that kind of surgery, or any kind of surgery, was not going to be the long-term solution for the problem. Did the research and figured out exactly the mechanism. That's what was figured out. What is the mechanism of this thing that everyone calls TMJ, which is the name of the joint? Temporomandibular joint disorder is one disorder caused by damage to the joint of three varieties, three categories of damage: bruxism, acute trauma, and functional malocclusion. Bites that are so bad that create damage within the jaw joint, and all three of those create chronic inflammation within the joint itself, and chronic inflammation creates all the disparate symptoms. It is that simple, and that can be proven. No one disputes it. I have worked for the past 15 years to bring this to the attention of the public. We now have over 50 doctors throughout the United States in 20 separate states who use the Urbanek device and protocol to treat temporomandibular joint disease successfully. None of those doctors have ever contacted me, called me up, and said the device doesn't work, as long as the patient uses it according to the protocol and they know how, and the doctor knows how to use it correctly. Sometimes they're a little confused. We straighten them out and then we get them back on the narrow path. However, no one's ever been able to say it doesn't work when it's used correctly, which is quite astounding. We have a practice here in Middle Tennessee that has treated well over 5,000 patients successfully and have 950 doctor-patient offices that refer us patients. So I have been able to see thousands of patients with this problem, and it's a sobering experience for me to see what our system has available and what the system has done to a vast majority of these patients who are run in circles, literally in circles, between doctor and clinic and emergency department and chiropractor and physical therapist and dentist and back to the physician. And the things that have been tried and done that are way more complicated in trying to solve the problem than surgery. And that each of those things could have taken my time, and I've actually, in each one of those, or almost all of those, I have produced a separate podcast talking about dry needling, treating a symptom, the drugs that are prescribed for this problem, especially for the migraine headaches, that no one can define what a migraine headache is, let alone how a migraine headache is produced. But we know that the temporomandibular joint chronic inflammation creates bad headaches that are confused by the physicians constantly as migraines and then treated with drugs. And the reason I titled this particular episode "A Patient with TMD Run in Circles" is a sobering experience, because yesterday, my day of the week to see patients in our practice, I only see patients 1 day a week any longer, was an 18-year-old who had a 6-year history of headaches, really bad headaches. And she was 25 years old and began having headaches in a severe form, what she called migraines, when she was 18. And she had seen everybody and every kind of provider and experienced all kind of different treatments over that 6-year period. They were all attempts to treat symptoms, and came in, finally someone recognized that she may have had temporomandibular joint disorder, came in, and her history was obvious. She had experienced every one of the usual and customary disparate symptoms, but migraine headaches was the top of the list. That is what she was pushed around and between all of the different providers. She came from a community about an hour away from Nashville, which is very common. We get people from all over the state, but just a tremendous number of people from Middle Tennessee, and shared with me her experience as her husband sat there and listened and agreed, and went through all of the different treatments that she had been seen, and especially the number of drugs that she had been placed on, which were innumerable for her migraine headaches, which she was still on several of these drugs. And as I sat back on my little doctor stool and listened patiently, I really became sober. Sober being the definition of, when it impacts you to the point that it brings your reality up to a higher level. And and so as I began to listen to her symptoms, she shared with me that there was something new that she had experienced within the past couple years, which was a tremor on her hands, and asked me if I knew what that might be. And I said, yeah, that is highly likely to be the side effect of one of the neuroleptic drugs that you have been placed on for the past 6 years. And she said, well, if we quit the drugs, will it go away? And I said, well, it may go away or it may not go away. We'll have to see. But this is the kind of the norm of the patients that we see here in this practice. And I really need to be very overt and direct from this point forward is trying to get this problem solved, because there are too many patients out there who exhibit the side effects of the drugs or the side effects of Botox. I am now learning, after speaking with many of the women who run and deliver the episodes or injections of Botox, that over a period of time that the Botox itself, because I've never used it, I've never delivered it, I didn't agree using it certainly for temporomandibular joint problems, but even for aesthetic problems, that it causes the tissue, the muscles and tissue beneath the skin to sag and relax, and actually makes the problem worse as time goes on. I did not know that, and I've learned that and heard that now from several aestheticians who use it, and they're actually beginning to channel patients away from Botox for aesthetic reasons, amazingly so. But that's just one example. Botox being used to paralyze muscles that are in trismus, that are tight, and there is pain because the muscle tightens up. I've explained many times how that actually happens, but it's created by inflammation in the joint, telling the muscles that move the jaw to tighten up. Pulls on the bone, stimulates the nociceptors. Now you have pain in the face, and the pain moves around because the nerve fibers and the nerve signals move around. They don't always attack the first one muscle and another muscle at a time. They move around. They can be in the lower face, the mid face, the upper face. So many patients think they have sinus problems because the muscles here start pulling on the bone, and they think it's a sinus problem, and misdiagnosed as a sinus problem. Put on sinus medication or sinus surgery. I've had several of those. Had sinus surgery thinking that it's a sinus problem. Of course, the symptoms don't go away after the sinus surgery. and the symptoms of pain in the muscle return after the Botox wears off. So this is the state of art in 2026, June the 30th, actually, of 2026. We see it so often. And this young woman, I just had so much empathy for her, as I do everyone who has this problem. And my colleagues and the public need to be aware of how much this problem is misdiagnosed, mistreated, misdirected, and that the pushback from both the dental and the medical industry profession is rather severe, I believe, because it challenges the status quo. The status quo to keep things the way they are, and that is not okay if you know that there's a simple solution, for sure. So I could go on and on about how often this happens in our practice, how much my colleagues who use our technology agree with me, and they see the light. But as far as getting the word out, getting the awareness out to the general public through the usual lines of communication, which is, through the scientific literature. It is no secret, I've spoken on it briefly before, but I've actually tried to get this information in a appropriate scientific form before my specialty the American Association of Oral and Maxillofacial Surgeons, and actually have been denied access to my own colleagues 3 separate times at meetings, at national meetings. And I'm a card-carrying oral and maxillofacial surgeon through the American Association of Oral and Maxillofacial Surgeons, boarded in oral and maxillofacial surgery. I have my boards in oral and maxillofacial surgery, and been denied actually 3 separate times to speak before my colleagues, just to make them aware of the simplicity of the problem, which then will challenge the status quo of doing surgery on the temporomandibular joint. Same thing applies to the ENT surgeons, otolaryngologists. I made a special effort to speak before one of the largest groups in Middle Tennessee. They'll go unnamed, associated with a hospital, that are otolaryngologists, ENT surgeons, who have no solution for Meniere's disease, which by definition, the definition of Meniere's disease is tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, and vertigo, dizziness, and explained to them what I had discovered, how it works. Those 3 symptoms are well-known symptoms within the doctors who treat TMD. Any kind of dentist who treats TMD long enough will have patients complain of ringing in the ears, subjective hearing loss, or vertigo. Not necessarily all 3 at the same time. Many do have all 3 symptoms simultaneously. Many have just 1 or 2, but those 3 symptoms are defined as Meniere's disease according to the ENT doctors. And the group that I talked to basically didn't want to hear the pretty simple solution to tinnitus, subjective hearing loss, and vertigo, the non-painful symptoms of temporomandibular joint disorder. I believe because it rocked the status quo. I could go on about the same thing applying to ear infections versus TMD. Ear pain is the 3rd or 4th most common symptom of TMD, just ear pain. To the patient, it feels like ear pain. And they go to a walk-in clinic, a convenient care clinic, and come out with a prescription for antibiotic 100% of the time. If you go to a walk-in clinic, a convenient care clinic, and with a complaint of ear pain, I promise you, you will walk out with a prescription for antibiotic, basically diagnosed as ear infection. And I could go on about that, and how those patients are literally run in circles. Eventually they may get referred to an ENT physician doctor who is more sophisticated at looking at ears, and then told, I can't find anything wrong with your ear. I don't see an infection. And the patient says, I'm telling you, my ear hurts. And in Middle Tennessee, we have made great progress on the doctors now, after a good 15 years, and especially over the past 10 years, as what I have discovered and teach is promoted and disseminated. In Middle Tennessee, we have a lot of doctors who are seeing the light, but I am speaking really about the professions nationwide. It just has to change. It just has to be known that this problem, TMD, is just not that complicated and doesn't take that much to actually make the symptoms go away. When you make the inflammation in the joint go away, when you make the inflammation in the joint go down by unloading the joint, in this case temporomandibular joint, it works the same way for knees. You put the patient on crutches. If they don't want surgery, put the patient on crutches. If they stay on the crutches, the knee pain will go away. If you have a tennis elbow, pain in the forearm because the elbow is inflamed, comes across to the patient as pain in the forearm. That's called tennis elbow. And the solution for tennis elbow is to put the patient in a sling long enough for the inflammation in the lateral epicondyle of the elbow to go away, at which point the pain in the forearm goes away and the problem goes away. That same phenomenon, that same mechanism works in the temporomandibular joint. And when you rest the temporomandibular joint long enough with a little device that separates the back teeth long enough, because 90% of the loads on the joint itself come from the posterior teeth. So, and this whole process was begun because my patients began to tell me if I put my finger, a pencil eraser, a piece of cloth between my front teeth and gently bite down, it feels better. I heard that a dozen times and I thought, what's all that about? And made a device that went between the front teeth well enough that they could keep it there, speak with it in their mouth, keep it in long enough. You have to start out 24/7. You can't just flip it in and out. It's got to stay in 24/7 except when you eat, and you separate the posterior teeth where all the loads come from the posterior teeth generated into the joint. When you keep that device in long enough, which is protocol is 2 months, 24/7, nighttime only the rest of your life. Chronic inflammation goes away and the symptoms go away. That is the story. It's a sobering experience to view these patients firsthand, to know their history, to listen to their history, to see a young woman who's starting to have tremors because she's been on neuroleptic drugs so long and not do anything about it. I'm doing my best. I am working on it diligently to get the word out. If any of you doctors out there want to find out how to use this device and protocol correctly, there's an online course where you can learn how to do this and be certified to be a person, a doctor who can deliver this. You have to be a dentist. Physicians don't know enough about teeth to actually pull this off. I wish they did. I was told when I was in medical school I needed to educate. I needed to do a lecture to my medical student compatriots, colleagues, while I was in medical school. The dean told me he wanted me to do a lecture to teach the other medical students what they need to know about dentistry, and he gave me 1 hour to do it. That was an experience. So physicians don't really have enough knowledge about the mechanisms of the jaw and the teeth and the joint. But you have to be a dentist, and if you take an online course, you can deliver this to your own patients in your own practice. I much prefer you do that than everybody traveling here to Middle Tennessee. We get people from out of state now, more commonly. I really, and if you're a patient, if you are a person who thinks they have this problem, these symptoms kind of come into your universe and say, well, maybe my migraines are not migraines. Maybe they're actually TMJ headaches. If you talk to your dentist and he talk your dentist into taking the course and he can treat it. It's not a complicated thing. It's not complicated. There are some things you need to know. There are some things that the doctors need to know. And the patients themselves have to be willing to go through the protocol 24/7 for 2 months, nighttime only the rest of your life, and be seen periodically by the treating doctor, because you want to make sure that it's done correctly and that the nuances are in there correctly and that you don't cause any further problem. Well, that's what I have to say today. It is a sobering experience, and it's only sobering for, right now, 2 people. That is, the people who know that there is a solution to this problem and continue to see patients who have been run around in circles about this problem, not just for years, as this woman that I noted had been for 6 years, some for decades. A great number of our patients have been run around in circles about this problem from doctor to doctor for 10 years, 20 years. I have a couple of patients who have been literally misdiagnosed, run around in circles for 40 years. Older people in their 70s, in their 60s, 70s, who continue to have these symptoms. and been treated for everything but temporomandibular joint disorder. Just got to stop. So it's sobering for the patients themselves, and it's sobering for the physicians who are trying to treat it and get it treated correctly. With that said, I invite you to come back in a week. These are recorded every Tuesday morning. They are designed to educate, to stimulate, to give the patients hope that there is something that could be done, because we see so many people who come in hopeless. Oh, they say things, this is not uncommon. I'm here, I've been referred here, you are my last hope. Or some of them come in pretty angry because they know something's wrong when they've been referred and sent around to a half a dozen or more, 10, 15. I had one patient years ago, this was not recent, but I had one patient tell me that over a period of 20 years, she had seen 100 different doctors trying to figure out or give her help with what were, as turned out when I did the examination and listed out the symptoms, the usual symptoms of headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain, arm, hand, finger tingling and numbness, and various kinds of jaw locking. And she said, I have seen 100 doctors over the years. I mean, really, this has got to stop. All right, with that said, I look forward to the next time you come back. I hope this is meaningful. I hope it impinges a little bit, whether you be a doctor, a dentist, a physician, a nurse practitioner working the convenient care clinics, or especially the patients. You can play a part in this by encouraging your provider to understand it. There are now 259 podcasts available that explain this problem on YouTube for your dentist, on Dental Town, and you can listen to them, I believe, on Spotify. So for today, we'll leave it until next time. I look forward and hope you come back for another edition of TMD Demystified. I am Tony Urbanek.